And new at 6, lawmakers in Montgomery are debating a bill supporters say could help stabilize Alabama's struggling ambulance system. The I-Team's Valerie Bell takes a closer look at Senate Bill 269 and the debate surrounding it.
At the end of the day, our SB 269 will save lives.
Supporters of a bill moving through the Alabama legislature say the state's ambulance system is under increasing pressure, with counties across the state already stepping in to help keep some services running. They warn without changes, response times could continue to grow.
That's one thing we're trying to do in this bill is get the rates up to a sustainable, rate that we can keep our services out there, because you've seen over the past few years ambulance services have just cut services, and basically we're just tired of arriving too late and people dying before we get there.
The bill, sponsored by State Senator Bobby Singleton, would set reimbursement rules for emergency ground ambulance services paid by health insurers, and surprise billing for patients who call 911, limit what patients can be charged to their in-network cost-sharing amounts, and require ambulance providers and insurers to submit financial reports to the Alabama Department of Public Health.
How would this have an impact on people who don't pay that ambulance bill when they get it, or maybe don't have insurance?
This bill will protect them in a sense too, because it's going to name a rate that we have to charge, and everybody will be able to charge the same thing. So if you don't have insurance, you're not going to get any price gouging from someone. There's going to be a universal rate that we can charge, so you'll actually know what that rate is, whether you have insurance or not.
The bill also includes a provision supporters say could help reduce unnecessary trips to already crowded emergency rooms. Under the Treat in Place clause, EMS providers would be reimbursed for evaluating and treating patients on the scene, meaning EMS crews could treat some patients on scene without tying up ambulances and staff for non-emergencies. Sonny Brassfield, executive director of the Association of County Commissions, believes the legislation would help with response time and declining service and put Alabama on par with neighboring states like Georgia and Mississippi.
More than 40 counties are subsidizing ambulance services today in Alabama, and we expect that number to continue to grow, despite the fact that here in Alabama we find ourselves behind our neighboring states.
From your perspective, are there any counties that are seeing more of a need than others?
Well, certainly, the assumption is that this is a, air quotes, rural Alabama problem. It is a problem in rural Alabama, but it's also a problem elsewhere. There are pockets of locations in Jefferson County, the state's largest, where there are difficulties in providing ambulance services even there. So, in my opinion, this is an Alabama problem. It's not a rural problem.
But the proposal is drawing pushback from some groups within the insurance industry. The Alabama Farmers Federation, which operates Alpha Insurance, argues the legislation could lead to higher premiums for some Alabamians.
These are small business owners, farmers, and independent contractors, because the other insurance products are exempt from the bill. And so we're asking a small group of people to bear the burden on rural ambulance and ambulance service providers across the state, and we think that's fundamentally unfair.
The Federation also believes much of the additional reimbursement money would benefit large companies in metro areas, in turn arguing there would be little benefit to EMS providers in rural areas.
Most of the ambulance rides in Alabama fall into two categories of insured, Medicaid and Medicare, and those are federally set. And so if we really want to help ambulances, those are really the two big insurance groups that we need to address. And the state of Alabama can't address those. That has to be addressed federally.
Alpha says it supports addressing the availability and affordability of healthcare services.
The Alabama Farmers Federation supports EMS. This isn't against EMS. We appreciate what they do and realize how necessary they are. We just believe that this bill overburdens a small group of people, and it is going to increase premiums for those insureds, and it's not really going to solve the problem.
Supporters of the bill acknowledge there could be small premium increases, but claim the impact would be limited.
There will be probably some premium increases with this, but we're talking about a fraction of a penny on a dollar. And I think some services or insurers that looked at that and are talking from 70 cents to $1 a month. Is that worth a life saving?
If the bill becomes law, it would also require a statewide study examining how the changes impact ambulance access, response times, and cost. It would also require the state to hire an outside expert to analyze those results and recommend ways to improve EMS access.
I think that 2 or 3 years from now, the legislature can take another look at this issue, but immediately what it should mean is that there's more money to reimburse for the cost. We ought to be able to restore some of the service that has declined. We should be able to attract, additional and better qualified employees so that we provide better service at the local level.
In Montgomery, Valerie Bell, ABC 3340 I-Team.